Do you remember the first time you heard a crime that involves organ trafficking? Well, I'm Jawan Perkins, and this is the Zulu News Network, and we have a New York City man was sentenced to 2.5 years in prison Wednesday, and what experts said it was the first federal conviction for profiting from the illegal sale of human organs. Levi Rosenblum, an Israel native who resides in Brooklyn, pleads guilty in October to brokering 3 illegal kidney transplants for New Jersey-based customers in exchange for payments of $120,000 or more. Rosenblum was arrested in July 2009 in a sweeping federal case that became the largest corruption sting in New Jersey's history. Prosecutors alleged Rosenblum would buy organs from vulnerable people in Israel for as little as $10,000 and sell them to despite patients for more than $100,000. The transplants took place in a U.S. hospital, including the Albert Einstein Medical Center in Philadelphia.
Good evening, viewers. Welcome back to the Zulu News Network. Tonight, we're going to be delving into the case of Levi Rosenblum. Levi is a 61-year-old Israeli native residing over in Brooklyn. Rosenblum is of Caucasian ethnicity and is often seen wearing business attire, exuding confidence and composure. Victims of organ trafficking in this case are not explicitly described, but we do know at least 3 victims have been involved in having their kidneys trafficked from Brooklyn to New Jersey. Next, I have 2 experts in the field, Gwen Hagopian and Gabby Yamas, who are going to discuss factors contributing to the case.
So, I overheard you guys talking about strain theory and how it relates to the case, but in what ways do the victims' actions align with that theory?
So the victims experienced strain due to their health condition and the limited availability of legal organ transplants. The strain leads them to seek out illegal means such as organ trafficking to alleviate their suffering.
Strain theory helps us understand the motivations of both victims and traffickers in organ trafficking cases. Victims experience strain due to their health condition, while traffickers like Rosenblum may experience strain due to financial pressures or perceived opportunities for profit.
So Rosenblum was only sentenced to 2.5 years. What are you guys' opinions on that?
So some research done by Dr. Gabriel Danovich, medical director of the kidney transplant program at the University of California, Los Angeles, said that the process of live organ donation is effectively governed by trust, and that more regulation could deter legal donors. Doctors and hospitals know their reputations would be destroyed if they broke the law, he said.
They caught on to Rosenblum's actions when they noticed a weird smell from one of the kidneys that they had donated.
So the lab workers in this case were aware of Rosenblum's actions.
The trafficking was made possible by the hospitals and the doctors that were successfully hoodwinked into believing the emotional relationship between the donors and the recipients. They turned a blind eye to the signs of impropriety, or they were complicit.
So, given the severity of Rosenblum's actions and the harm that he inflicted upon these vulnerable victims, what do we feel that he deserves as punishment?
Well, Rosenblum's exploitation of these desperate patients and donors for financial gain is reprehensible and deserves punishment that reflects the gravity of his offenses.
Considering the harm caused and the need to deter similar criminal behavior in the future, it is imperative that Rosenblum receives a substantial prison sentence, minimum of 10 years per each victim that was trafficked.
I also think that it makes sense for Rosenblum to have to be required to pay restitution to the victims. And there, he's going to have to contribute to efforts also aimed at combating organ trafficking and supporting survivors like them.
Yeah, and furthermore, Rosenblum's conviction should serve as a warning to work to deter others involved in illegal organ trafficking operations. They need to know that they will be held accountable for their actions.
Exactly, Gwen. The punishment of Rosenblum should reflect the seriousness of his crime and send a clear message that organ trafficking will not be tolerated.
So next, do we have any recommendations to maybe addressing and preventing organ trafficking in the future?
Yes, I believe a focused approach is necessary to effectively combat organ trafficking. I'd say we need to strengthen international cooperation, coordination, and partnership among law enforcement agencies to identify and dismantle trafficking networks, which operate across borders.
I see. So by enhancing collaboration between countries and law enforcement agencies, we can better track and apprehend the traffickers, disrupt their operations, and bring them to justice.
This approach also allows for the sharing of intelligence, resources, and enables more targeted and effective interventions to help combat organ trafficking globally.
Prioritizing international collaboration among law enforcement agencies is essential to effectively combat organ trafficking and to protect the rights and well-being of individuals worldwide.
So to conclude, this organ trafficking case regarding Rosenbaum is really showing the disturbing reality of the crime and just how vulnerable people are routinely exploited for financial gain by people like him.
In this case, Rosenbaum portrayed himself to the victims as a savior by appealing to the desires of the victims, but his actions were truthfully motivated by greed and exploitation.
As for the victims, they were driven by desperation and a lack of access to legitimate medical care.
While resources for crimes like this are scarce, one organization addressing this issue is the International Organization for Migration, which works to prevent human trafficking and support victims worldwide.
Thank you for joining us tonight. Remember, it's on us to stop organ trafficking.